Every Woman Matters is a program that helps women between the ages of 40 and 64 who meet certain income guidelines and have little or no health insurance pay for breast and cervical cancer screenings. 95% of primary health care providers in Nebraska support Every Woman Matters. In 2009, the program performed over 12,000 clinical breast exams, 10,000 Pap smears, and 8,000 mammograms. Every Woman Matters also offers a lifestyle intervention program that screens women for cardiovascular disease, diabetes, and promotes healthy habits. Finally, the Nebraska Colon Cancer Screening Program helps men and women between the ages of 50 and 75 pay for colon cancer screening tests. And remember, all of these programs are provided at low cost or no cost.
Every Woman Matters is a program set up for people who can't afford health insurance. I couldn't afford it, and the job didn't offer it, so Every Woman Matters was a big, important event for me.
When I went in, they found a lump in my left breast, and I couldn't feel the lump. I didn't even know it was there.
When I was 58, I thought that's the age my mother and my grandmother both died of cancer. And I thought, oh, maybe I should go check and get a mammogram. But I knew they were expensive, and I've heard horror stories how horrible they were.
A good healthy weight for me is, 135, 140, and I made it up to about 165. And I was diagnosed with depression. I was put on Zoloft, and I was trying to do some counseling, but it wasn't helping. It wasn't getting me where I needed to be.
The work that I did find, like I said, I was always part-time. I did daycare, I worked for Merry Maids. I mean, I didn't work full-time, and you don't get coverage when you do that. So what I did was basically gambled with the life, and I still do.
My mother and father both died of cancer. And by the way, my father ate healthy. And he was not a pop drinker, wasn't an alcoholic, didn't smoke. And woke up, had pain in his stomach, went to the doctor. It was at level 4. They said, okay, we better open up and see what's going on. Open it up, he had spread to his liver. That was it.
I went and had a Pap smear and a mammogram, and they found out that I had breast cancer. I was very, very upset because I didn't have health insurance, and I didn't know what to do. How was I going to handle it? I didn't have a lot of money. I didn't know a lot of people here, and I was lost.
I cried probably for 2 days. Actually, it was the telephone message that my doctor's nurse called and said she wanted me to come in and see the doctor the next day. And I thought, no, that isn't good. If it was a good results, they would have never told me to go in. So, and I think it's the initial thought that cancer, because of my grandmother and my mother, it's just, cancer is just such a dirty, scary word.
So in turn, I called Every Woman Matters, and I explained the situation to the lady on the phone. And she told me, she said, you don't have anything to worry about. All we need you to do is think about getting well, and we're going to take care of everything.
I called them up, I gave them all the information, I paid my $5, they said I'm okay, and then once I got my paperwork, that's when I went to the doctors and had my mammogram, and that's when they found out that there was something growing in there. I wasn't totally shocked. I was sorry that I had it, but I had a lot of faith in the good Lord that I knew. I always live with my gut instincts that they caught it early, this is a good thing.
I think because I caught it so early, and I was so aggressive with trying to get rid of it and eliminate it, I didn't have to go through the chemo. I didn't have to go through the radiation.
And they paid for everything, which, like I said, I was blessed. If I didn't have that, I don't know what would have happened to me.
I thank God every day for Every Woman Matters, because if it wasn't for that particular program, I don't know what I would have done. I maybe would be dead by now. But that program helped me.
Through Every Woman Matters, I was introduced to a health and nutrition program, which served twofold because it gave me the nutrition information I needed to pick a healthier diet, to make better choices. To learn portion control was huge.
Whenever I had a problem, if maybe say a bill didn't get paid or there was a mix-up with something, I called her and she always took care of it. So I have no complaints with Every Woman Matters. In fact, I try to tell people about it myself.
It's just a blessing that they're there, because they covered the first mammogram, and then at first when they thought they seen something, I had to go back in and have another mammogram. I mean, my insurance would not have covered that.
Go to the doctors. And whatever fears or worries that you have, put that in the back of your mind. Go to the doctor, get screening, do your colonoscopies, do the blood check, whatever it takes. But know for sure that, that you're healthy.
I'm just thankful every day when the good Lord lets me wake up. I mean, I've always felt that way, whether I had breast cancer or not. I don't think it made any drastic change. You just appreciate life. I mean, even though I've had so many losses in my life, I still appreciate it, and I don't really want to die.
I thought I was healthy. You don't know. And it's better to be sure, to know, and never have any doubts.
For more information on Every Woman Matters and the colon cancer screening program, please pick up the phone and call us at 1-800-532-2227. The enrollment process is simple, and it could save your life.